Good afternoon, everybody, and thank you for joining us on our webinar. My name is Mariam, and I am the Training and Comms Officer for the Lancashire Safeguarding Business Unit. Our webinar today is around CSPRs, which is Child Safeguarding Practice Reviews and Rapid Reviews, and it will be delivered by all our statutory partners. Just to mention, if there's anybody that's having any technical difficulties in joining, I have pasted the webinar link into the chat. If you can just share that with any of your colleagues who might be having any difficulties. Thank you. Okay, so just some housekeeping for today. All your cameras will be automatically switched off when you join the webinar, and all microphones will be put onto mute. We will be having a Q&A opportunity at the end of the session. If we can advise you to use the Q&A function at the top of your Teams channel at the top, just so the questions don't get lost in the meeting chat, and then we will review all the questions at the end of the webinar and answer them, and it will give us all an opportunity for any discussions. This webinar will be recorded, and the slides will be sent out with any additional resources. Okay, so just to go through the aims and objectives. So the aim of this session is to share information and raise awareness on why and when a CSPR is undertaken. It's to show the importance of multi-agency working, sharing good practice and learning, and information sharing. So we hope by the end of the session you will be able to recognise what a CSPR is and when it is carried out, know what the rapid review process is, understand the term chronology, demonstrate an understanding of the importance of multi-agency working together, know where to access tools, materials and local guidance, understand the statutory requirements on partners in respect of assurance on learning and changes, and the contributions from partners to learning, developing and enhancing policy and practice. So first up we have our speaker, which is Peter Yates. So over to Peter.
Thanks. Excuse me. Thanks, Marion. Afternoon, everybody. My name's Peter Yates. I work for Lancashire Constabulary. For the last couple of years, my work has involved representing the Constabulary on things such as CSPRs, adult equivalent SARs, CSPR being a child safeguarding practice review, and an SAR for adults being a safeguarding adult review. I really welcome this webinar today. As much as anything, enhance people's knowledge as to what child safeguarding practice reviews are about. But hopefully, if we do our presentations correctly, take away some of the angst that sometimes goes when people are told, oh, there's a case I've been involved in, going for a child safeguarding practice review. And I'll cover what child safeguarding practice review is now. But what I do want to say at the start, they are not witch hunts. They are not about trying to find people who has done something wrong. It is about seeing other areas where maybe we could develop a different process, protocol, etc., which might mean that in the future we might prevent something happening. And again, as we go through a child safeguarding practice review, there are, and this will be covered later, but there are a number of panel meetings that people from multi-agencies attend, and as well as identifying areas of development, there are often a lot of areas of really good practice which are identified. So it's not just a one-way street, and a lot of that good practice is then passed far and wide across the county from time to time. So what is, if we move on, Marion, please. So what is a child safeguarding practice review? It's an independent review, and by independent review, it means that we do have an independent author. It is attended, they are attended by, and this will be covered later, but they are attended by representatives from multi-agencies across all the various health, children's social care, police, housing, you name it, agency that might have had an involvement with that child. So they're an independent review into a case where a child has been seriously harmed or has died, and abuse or neglected is known as suspected. So they're carried out where local partner organisations identify there may be a learning from the case to improve the safeguarding and welfare of children. Excuse me. And a lot of that emphasis is not on what somebody might have done wrong, but it's about looking at how organisations can potentially work better together. And the aim of Child Safeguarding Practice Review is to establish any lessons learned from the case and to identify how they have or will be acted upon and lead to sustainable improvements to practice and the prevention of death, serious injury or harm to children and young people. So at the end of a review, quite a lengthy report is submitted, and as a result of that, actions come out to see what can be put in place to sort of make sure in future we close maybe some of the gaps that are there or improve our practices. Okay, Marion, thank you. So when do we do it? And it's a lot of it was covered in that first slide really, but when do we do it? Well, working together to safeguard children 2018 and 23 requires safeguarding partners to identify serious child safeguarding cases and to make arrangements to commission and oversee reviews of those cases where it's considered it's appropriate for a review to be undertaken. And the main two things is we've got a child who has died or has been seriously harmed. And we'll touch a little bit more on seriously harmed on the next slide. And then it's thought amongst agencies that abuse or neglect of the child is known or suspected. But both of those two, so a child has died or has been seriously harmed, and there is the abuse or neglect, is when we might look to, we agree that the criteria for a CSPR has been met. Okay, Marion, thank you. Serious harm. This is one that is probably the most difficult bit to when we hold our rapid review meetings, which I know Danielle is going to cover after me. Trying to identify if a child has actually suffered serious harm. The definition we've got to work with is serious harm includes, but it's not limited to, serious and or long-term impairment of a child's mental health or intellect, emotional, social or behavioural development. It's not an exhaustive list. When making decisions, judgment needs to be exercised in cases where impairment is likely to be long-term. And that's often some of the issues that we're potentially faced with when we're making a decision whether child safeguarding practice review should take place or not. Even if a child recovers, including from a one-off incident, serious harm may still have occurred. So that's very briefly just to give you an overview of what a child safeguarding practice review is and when we do one and around the serious harm. The main thing from my bit, what I'd like you to take away is very much a case of it's not looking to try to get somebody into trouble. It is trying to look as we progress in the future to plug gaps that there might have been, develop protocols or processes which might make delivery from multi-agencies an improved service across the county. Thank you very much.
So hi everyone, I'm Danielle Winkley and I'm a senior manager in Lancashire's Children's Social Care, so I'm part of the Safeguarding Inspection and Assurance Unit, and part of my role is that we fulfil the statutory partner role in rapid reviews, which I'm going to talk a little bit about. Now I know this is a really complex slide, so I'm just going to highlight some key points really. But if we receive a referral form into the business unit, it starts off this complex process. And what I think I first of all wanted to say was, if you've heard Pete's definition and you think now or in the future, I've got a case that might meet that criteria, you really need to speak to your single point of contact in your agency. So if you're not sure who that is, it's probably your safeguarding lead. So if you speak to them about whether it meets the threshold and if you want to put a referral in, but if you think of anything else as well, you think you want to ask any questions, please come to me, Pete or Helen, or email the business unit mailbox and one of us can get in touch with you to discuss it. So when that referral comes through, it comes through and we agree if a rapid review is required. We then do an incident notification to the national panel, which is part of the DFE. And then following on from that, we'll hold the rapid review, which all this timeline a lot about is how we coordinate that. So that's where we collect all of our multi-agency timelines. So we collect them, and it's really important that we get them back to the business unit in time so that rapid review can be held within 15 days of us making notification to panel. Then we hold the rapid review, and then we have an outcome of either it's going to a child safeguarding practice review or there's going to be no CSPR, but what we do is we still do the actions and learnings from the CSPRs. If there's been something from the rapid review, sorry, that we still think there's a little bit of learning about, we still take that on board. Helen's going to talk about the CSPRs and Fahim's going to talk about if we don't have a CSPR and what other actions we can take. So that's just something you can have a look at in the future, but it just helps to guide through what the process is. Could you move on to the next slide, Miriam? Okay. So the rapid review referral. So all three partners, that's health, police and children's social care, are part of the rapid review meeting. So when we hold that meeting, we have to let national panel, the DFE, know the outcome within 15 days. We've already considered that referrals meet the criteria. Child has suffered known or suspected abuse or neglect and has died or suffered serious harm. Again, please speak to us if you think you've got a case that meets that criteria. Yeah, and as we said, if you complete the referral form with as much detail as possible, or give one of us a call, we can talk you through where we are, because as a children's social care agency, as a police agency and as health, we might have additional information that we can share. So the chronology and timeline. So when we've got the decision that we're going to hold a rapid review for a child, we send out the request for a timeline to all our SPOCs, our single points of contacts. These chronologies are completed and returned to the business unit, and then we combine these to make a multi-agency timeline chronology. It's really important that we collate the right information for that timeline, and it's important that we have that communication about names, dates of births and national insurance numbers or any other unique identifiers that we have of people that might have been living in that household at that time. There might be information that one agency has about who's been living in the house that other agencies don't. So it's really important we have that communication back to the business unit to share your information and then complete your timeline. But this is an example of the timeline. And as you can see, it looks like there's a lot of boxes, but actually a lot of it will be what information you already hold. So what agency you are from, what's the job role, who's been involved in that event, what that event has been. Then these last three columns are what's really important. So what's your analysis of that event that's happened? Was there any good practice? Please share it. That's really important. And then if there's any agency learning, we often have lots of discussions in the rapid reviews around these last three columns, because we need to know from other agencies what has worked really well for them. But also, where could have things been better? Where could have things been improved upon? And is there a reason that that wasn't done? So the actual rapid review meeting, when we come together, we have that multi-agency timeline. It's chaired by a statutory partner who's had no involvement with the case. So that might be police, health or children's social care, but by a senior manager, head of service, etc., who's had no direct involvement themselves with the case. It's attended by the 3 statutory partners, but we have representatives from all the agencies who's been involved with the family and who've completed that timeline, so that you can go through that analysis of involvement in the case. So your single agency learning, your good practice, what challenges have you found? It's not about talking through the chronology, it's about talking through the analysis, and it's about talking through that understanding of what happened for this family. The rapid review meeting attendees were also able to provide challenge to each other. And I think through experience of being on these panels for quite a number of years, we've got to know other agencies' practice, good practice, and what needs challenging. So in the rapid review meeting, just want to go back, Miriam. I just wanted to mention really kind of the structure of the meeting. So what we do is we discuss the case summary, like I talked about. We talk about what's happened, what could have been done to prevent abuse or neglect. Is there any typicality in the contextual factors? What changes could there have been to the way agencies operate to prevent this abuse or neglect? And is there anything agencies have already changed? So that's the bulk of the discussion really in the meeting. We then discuss, has there been a case with similar themes in the locality in the last 3 years and what's happened with that? So if there's something that we might have already seen, such as maybe a drowning of a child, what have we already done about that single incident? What have we done? What agency learning have we taken from that? And is there anything similar we can use for this child and family? We then look at immediate actions, for example, any other siblings in the household, what safeguards are in place for them? And then we look at any immediate and potential learning and improvement. So is there anything immediately we need to do? Is there any immediate learning that we can take back to that agency and then put into place? Or is there any briefings or is there any guidance that we need to relaunch urgently in our agencies? We then make a recommendation. So we make a recommendation, either it needs a national child safeguarding practice review, and that's where it's national level improvements we think are needed, legal changes or recurrent themes about national harm. So that's one of the recommendations we can make. We can make a recommendation for a local child safeguarding practice review, which is where we highlight improvements are needed at a local level. There's concerns regarding 2 or more agencies working together or effective safeguarding in the local area. And then the last thing we can do is to say there's not going to be a local CSPR, but local learning will be actioned on. And that's something that Fahim's going to talk about later. So we can still always gather the learning from them rapid review meetings to make changes to our organisations. And that's something Fahim's going to talk about, how we track and manage that in the future. Thank you.
Thank you, Danielle. Next we have Helen.
Good afternoon, everybody. My name is Helen Hargreaves. I'm the designated nurse for safeguarding children for the Lancashire and South Cumbria Integrated Care Board, and we are one of the statutory partners for our safeguarding arrangements in Lancashire. So my role today is to talk through the CSPR process with you. And the majority of my information today is taken from working together. So if there's anything that you want to recap on, then we will be sharing links from, resources that will signpost you to this document. So learning from serious child safeguarding incidents. Following the rapid review, like colleagues on the call have said, a copy of the findings and recommendations are shared with the national panel. And the reason that they do this is to see whether or not it's appropriate that the issues raised in our rapid reviews may be complex or of national importance, such that a national review may be appropriate, as well as having that overarching accountability and oversight of our local rapid reviews within our patches. So as soon as the safeguarding partners have determined that a local review will be carried out, we will inform the national panel. We'll also notify Ofsted, the Department of Education, and we'll also provide the name of the reviewer that we as a safeguarding partnership have commissioned to undertake the review. The national panel will then inform us if it considers that a national review is appropriate, and they'll set out the rationale for their decision making and also their next steps. If any further information is required to support the decision making, including whether or not us as safeguarding partners have decided to commission a local review, they'll also ask for that further detail too. There will be instances where a local review has been carried out, which can then form part of a thematic review that the national panel will undertake at a later date. If a local CSPR is required, then the safeguarding partners are responsible for commissioning and supervising that lead reviewer. It's important to note, though, that the case may also be subject to a criminal or coroner's investigation, an individual agency or professional body disciplinary procedures, and any other type of formal review. It is anticipated that a local child safeguarding practice review will go ahead unless there are clear reasons not to. Regardless of any potential delay to the child safeguarding practice review, it's really important that any learning or recommendations to improve practice must not be delayed as a consequence of any of those parallel investigations. Okay, so looking at the slide then, and we'll start going through the process itself. So the business unit themselves will organise and invite nominated representatives to that first panel meeting. It's the responsibility of the statutory partners to identify individual panel members who may be relevant or have information that will help provide learning for future practice. Whilst the membership of the panel will remain consistent throughout the review, it is important to note that the membership of the panels will differ for each individual CSPR. The only guarantee being that the statutory partners will be present in each review. The safeguarding partners with the lead reviewer agree the method by which the review should be conducted, taking into account any relevant guidance and principles of the systems and methodology recommended by the Monroe Review. Again, another resource which we will share as part of the resource pack coming out to attendees today. The purpose of the review is to look at and analyse frontline practice as well as organisational structures and allow those involved in the review to reach recommendations that will improve outcomes for children. It is important that all reviews should reflect both the child's perspective and the family context. The first panel meeting provides an opportunity for the lead reviewer to discuss the single agency chronologies, developing and agreeing key lines of inquiry with the panel. Agency representatives then have the opportunity to share information, providing updates on the case and informing each agency of any changes or learning already made and implemented into practice. It is expected that once the key lines of inquiry are agreed, agencies will then begin writing their individual reports in preparation for the second panel meeting. The agency representative is responsible for feeding back to their head of service and agency lead following each panel meeting. The second panel meeting is held to then bring together the responses for the key lines of inquiry that were established at panel number 1. This allows the lead reviewer to then gain a more detailed understanding of the case, the areas of learning identified, and provides an opportunity to identify good practice. By this point, the lead reviewer is able to begin drafting a report based on the information collectively provided by each agency. The business unit will now organise a practitioner learning event. It's the responsibility of each agency's panel representative to identify those appropriate practitioners, quite often those who were directly involved with the child and the family, and we will then request their attendance at the practitioner learning event. It is the responsibility of the panel rep to support the practitioner both pre and post the learning event in relation to its purpose and the expectations. Peter did talk about the practitioner learning event briefly before, but part of this process we do to celebrate that good practice. It's not a witch hunt, like Peter alluded to before, and it's about supporting practitioners in identifying perhaps what we could have done better and what we can improve going forward. So as part of the process, the review panel may recommend that a practitioner learning event is held. All frontline practitioners and agencies who are involved with the child and family will be invited to attend. The key aim of the practitioner event is to collaborate with the practitioners from the different agencies who knew the child and the family. The event is designed to provide practitioners with a safe space and the time to reflect on their involvement with the child, their professional practice and their decision making. The information gathered at the event enables the reviewer to understand in greater depth the context that the practitioners were working in and whether there are any lessons that can be learned to improve practice. It also allows good practice to be identified and shared. It's really important to stress again that the review process is not to apportion blame. The process is designed to try and understand what happened and the wide range of factors that affected the way people responded to the circumstances of the case at that time. It is also there to identify good practice. So what the practitioner learning event will do is hear first-hand accounts of the involvement with the child or the family and any adults that were involved as well. Provides an opportunity to ensure that the accuracy of the case, so the story, is reflective of what we've already pulled together within the chronologies. It provides an opportunity to consider and analyse the interventions in a safe and reflective environment. It provides us with the ability to consider the context within which practitioners were working at the time and understand any challenges that people were facing. It allows us to explore what information, activity or circumstances that might have influenced the decision making, and it also allows us all collectively to consider recommendations for the review and provides an opportunity for practitioners to shape future policy and practice. Again, need to reiterate the point that the practitioner learning event will not be there to attempt to apportion blame, to single out any individual practitioners or to be critical of any specific agencies. So we then move on to panel 3 and 4. Excuse me. At the third panel meeting, it would be expected by this time that the lead reviewer has prepared a draft version of the report. The purpose of panel 3 is to collectively review this and quality assure the draft report, and then the recommendations can be made if not already done so in draft. It's important at this stage to ensure that the recommendations are realistic, that they're outcome focused and that they're appropriate. Panel 4 will provide us the opportunity to review the final changes and any amendments made in readiness for report sign-off at that lead executive level. The lead reviewer will finalise the action plan, and it is then the responsibility of the panel representative to share with the appropriate head of service or lead for their individual agency that action plan. Each individual agency is accountable for the recommendations in the main CSPR report, as well as the single agency reports that have been provided to support the report coming together in its entirety. Panel reps are responsible for reporting back on the progress against the actions using the business unit's action planning template. Again, something that can be shared as part of the resources to help with sort of follow-up following today's webinar. The recommendations from the report will inform the local child safeguarding practice review action plan. However, it is important to note that those single agency reports may have identified single agency actions, which are the responsibility of each individual agency to provide the assurance to the business unit and the safeguarding statutory partners re any progress and updates. The governance route for this is via the Performance Assurance and Improvement Group, which is a subgroup of the Child Safeguarding Assurance Partnership Board. Actions will be monitored and tracked by that group. Okay, so when compiling and preparing the report to publish, the delegated safeguarding partners should consider carefully how best to manage the impact of the publication on the children, any family members, any practitioners and others closely affected by the case. The safeguarding partners should ensure that reports are written in such a way so that when published, it avoids harming the welfare of any children or vulnerable adults involved in the case. Thank you. So just some key points to remember then. Practitioners are fully involved and invited to contribute their perspectives without fear of being blamed. Families, including surviving children, in order that the child is at the centre of the process, are invited to contribute. Families understand how they're going to be involved and that their expectations are appropriately and sensitively managed, and that the safeguarding partners must ensure that the final report includes the following. So a summary of any recommended improvements to be made by individuals or organisations in the area to safeguard and promote the welfare of children, an analysis of any systemic or underlying reasons or actions that were taken or not taken in respect of matters covered by the report. And finally, any recommendations should make clear what is required of the relevant agencies and others, both collectively and individually, and by when, and focused on improving outcomes for children. And just to finish, reviews are about promoting and sharing information about improvements, both within the area and potentially beyond. So the safeguarding partners must publish the report unless they consider it appropriate to do so. And should that be the case, obviously people will be informed, and it might well be that the national panel publish the report on our behalf, but they will publish it anonymously so that there is no identifiable factors within that. Okay, thank you very much.
Thank you very much, Helen.
Sorry.
So next we have Fahim.
Afternoon, everyone. My name's Fahim Chatty. I'm Business Coordinator from the Lancashire Safeguarding Business Unit. My role and remit is covering child safeguarding practice reviews and rapid review meetings whenever we get a referral, to kind of see them through the process of arranging the rapid review and ensuring that any learning and action planning that comes through from those rapid reviews or CSPRs is kind of followed up. Thank you. So as the theme has been throughout in terms of from information from the colleagues around CSPRs and rapid review, that it's the primary thing is around learning and improvement and enhancing practice. So with that in mind, following each rapid review and child safeguarding practice review, something that the business unit are central to is arranging action planning meetings. These are once again multi-agency action planning meetings where agencies will provide updates on actions that have been recognised from the rapid review as something that possibly needs improving. The Child Safeguarding Assurance Partnership, as mentioned by Helen, that the governance structure where this will be accounted for is within the Performance Assurance and Impact subgroup, and that is also coordinated by the Lancashire Safeguarding Business Unit. So there's the flow chart that was shared before. It shows how the assurance and updates are followed through to the Performance Assurance and Impact subgroup. Primarily, sometimes what we find within rapid reviews and CSPRs is that there are a lot of themes that are very similar. Sometimes we'll find very similar themes that are cropping up within rapid review meetings. For example, sometimes there's enhancement or practice that needs to be improved around information sharing or professional curiosity, or sometimes there's some things around professional escalation and disagreement and how that's done in the correct manner. So these are sometimes grouped together, and in the future the Lancashire Safeguarding Business Unit will facilitate and coordinate with support from the safeguarding partners webinars such as the one that we're carrying out today around these themes to improve practice, to help practitioners understand the resources out there, and from a multi-agency perspective. Following each child safeguarding practice review, once the report has been published or following or with the report publication, there will also be a 7-minute briefing or a Microsoft Sway Microsoft Sway, or even a learning brief template that will be shared across the partnership and disseminated across to members of staff through our distribution list, through various newsletters and means that we can use. The aim of this is to understand the improvement in practice, and also many times to highlight the good practice that was undertaken and identified throughout the CSPR rapid review. If we can move on to the next slide, please. Thank you. Something new that we are beginning to incorporate into our Lancashire CSPR and rapid review processes is a multi-agency reflective review. A multi-agency reflective review is a learning session for safeguarding practitioners relating to a safeguarding incident that may have occurred where a child or young person may have been suspected to have suffered abuse or significant harm. And there are opportunities for multi-agency learning and enhancing professional practice, but it does not meet the criteria that was discussed earlier by Peter in terms of the child. It does not meet the threshold for a serious incident notification. So, for example, a referral has come through and the statutory partners may feel that, yes, there's room for improvement in terms of there's something that could be learned here through this. However, it's not meeting the criteria or threshold for a serious incident notification, and those safeguarding partners, health, police and local authority, will come to that decision together. And they will say, well, we won't go down the route of a rapid review or CSPR, but what might be useful for practitioners and to immediately kind of get that learning out there, or to highlight some of the learning, is to hold a multi-agency reflective review. Once again, the business unit will help facilitate and coordinate this, and this will be something which does not have a time frame, but the quicker it is done, the better. And the aim of this learning session will be to facilitate knowledge exchange and kind of collaboration and professional development amongst safeguarding practitioners. Once again, it'll be a multi-agency learning session, and it'll be trauma informed and be facilitated by one of the safeguarding partners. And it also offers opportunities to enhance and reinforce professional practice. In terms of what some of the topics that are covered within a multi-agency reflective review, it is identified by case-by-case basis in terms of what's unique to the circumstances of that referral. However, once again, to understand where the learning could come from, the Lancashire Safeguarding Business Unit may request chronology and information to be shared by agencies prior to the session taking place. So there will be a request sent out from the Central Lancashire Safeguarding Business Unit email inbox to SPOCs or practitioners identified that may be useful to attend this reflective learning session. That information will be gathered and sent back to those practitioners. So when we come together on the day of the session, there's informed and understanding around the room and kind of learning in a non-judgmental way. Following the session, once again, similar to how we would do with a rapid review and CSPR, if there's any identified actions that need to be taken away and updated on, we will request for those agencies to provide updates. And expect updates to be provided in terms of any actions completed, as well as if there's any need for wider dissemination of material across to partners through newsletters, email distributions, or a Microsoft Sway or a 7-minute briefing, then the Lancashire Safeguarding Business Unit will help facilitate and coordinate that with safeguarding partners. Thank you very much. I think that's the end of the slide, so I'll hand back to you, Mario.
That is, thank you very much.
Mariam, I was just going to say, just to follow up what Helen was saying about the practitioner learning event. Potentially a number of the people who were on this webinar today will be their likelihood it will be attending learning events. Mm. It really is about being as honest as you can at them learning events. And you don't tend to get managers attending the learning event. It tends to be the practitioner, the person who's been dealing with the child or the child's family. And we do find out that processes which management have sometimes said as part of their chronology, this is the process, and for whatever reason it wasn't followed. It's when we get to that practitioner learning event and we get the practitioner actually explaining why it doesn't work. And it's great. It reads well on paper, but the practicalities are it doesn't work. And that's why it's really important that anybody attending a practitioner event is as honest and open as they can, because that's how we get the development. So it isn't a case of we rush back and tell the organisation, well, your practice isn't working. It's just something that's reflected on and may form part of the review process. So it is about being open and honest and joining in them practice learning events. So thank you.
Thank you, Peter. We do have one question, probably for Fahim. Danielle, how many rapid reviews and CSPRs are done per year?
Do you want me to take that, Danielle?
Go on then.
So in terms of rapid reviews, just to give you an idea, over the 23-24, we had 7 referrals that came into the Lancashire Safeguarding Business Unit, and we were just looking at it this morning. So there were 5 serious incident notifications made. Therefore, there would have been 5 rapid reviews that took place. CSPRs, sometimes these obviously are done over a period of 6 months. Over the 23 and 24, there weren't any that made that were commissioned for CSPRs. However, currently we have 7 CSPRs that are ongoing and approaching publication or at various stages within that process that was shown before. And those are CSPRs that were commissioned prior to 23-24.
Thank you, Fahim. We've got another question come through. How many MARs?
In terms of the MARs, we've had, as mentioned, we've recently started this process, and we've had a couple, so 2 in the last 6 months. There is for practitioners on the call, there is, once again, it follows the process of statutory partners getting together following a referral to consider whether it would progress to a MAR. That's usually done very quickly. It's not a long process, and we have a consideration meeting, I think, on Monday for a further MAR. So that would mean there's been 3 since we started this process.
I think prior to this process, things have been done a little bit more informally in terms of practice learning reviews, learning circles. You might have heard them being called multi-agency learning circles, have been held over the last few years, but we've really finalised that process so that we get all the learning together in a multi-agency partnership. We have somebody independently chairing that MAR, and then the learning can be fed back and shared.
And just to add, the referral form for all of these processes in terms of getting the process started is one single form where you can choose which option you are wanting the safeguarding partners to consider, and we will share that. Currently, it's in its final draft to be agreed by the by the CSAP board. So once that's been agreed, we will share that with attendees as well.
Thank you, Fahim. I think that's all for questions. Yes, so for those of you who joined a little later, as I mentioned at the start, we did record the webinar, so we will be sharing the webinar, and it will be uploaded onto our website, and we will share it with everybody who registered for the webinar today, as well as any other resources and the slides. Anything else, Fahim?
No, I think that's all. Thank you.
No?
From me. Okay.
So thank you very much for joining our webinar. And if there's any further questions, please do email us on the LSBU email address or lsbu@lancashire.gov.uk if you've got any questions. Thank you.
Thank you, everyone.
Thank you.
Thank you. Goodbye.